Hello to Nursing 313 Nation. Dr. Hastings here, giving you a brief review of NCLEX style questions related to the content I've taught so far in the class. Appreciate your patience as I'm trying to figure out the best student engagement tool. I think the Socrative tool will be good, and I did test that with my clinical group, so it certainly works. I just found that clickers were not going to work. And time is of the essence in class. It's a challenge to find that brief time. So I'll probably start integrating test questions into the PowerPoint as well, with the idea that our lecture time may be too limited sometimes to go to the external student engagement tools that I think are just much more effective than including those in PowerPoint. But that said, let's go to this review with some questions. Here's the critical time when you really need to get proficient with these, within a week before an exam. So let's go over some. First, just basic principles associated with NCLEX questions. You are practicing critical thinking. That means considering all the alternatives, thinking out of the box, all that. So the stem of the question, what is really being asked, is what's critical. Look at that question. What is the question really trying to determine? There's sometimes in the narrative some distractors associated with other themes or other aspects of patient care that aren't relevant. So you have to basically critique that. Ultimately, you have to reframe the question and prioritize what really matters here. Safety first, and then think about best of whatever, best assessment, best intervention, best response. So in that critique, it's all about how do you respond to the context, what's the question really asking, what's the best nursing response, and then evaluate the other responses in effect. Or evaluate all of them. Evaluate if they make sense, or do they just not match the context we're looking for? So that's really what we see with application-based questions. Let's do a few. All right, start with legal and ethical. That was a foundation concept a few weeks ago. And I'll ask you to pause after I frame the question with the video, so you try to answer first before you go to the next part. I'll have a slide with the question and a slide with the response. Patient tells the nurse in comments that he still has suicidal thoughts but doesn't want anyone to know because he's being discharged that afternoon. The nurse's best course of action is to look at the responses, pause your video here, and you're getting a YouTube video clip on Canvas, so you can certainly do that. And then I'm going to flip the slide, though, coming up to respond to the answer. So you'll unpause then for that for each question. Okay, so the answer is C. Inform the physician and other appropriate health team members. I want to always give this response in these sample questions, but I will give you a rationale with the actual lettered answer. We can flip back and forth. The patient right to confidentiality never includes keeping important clinical information secret per se. So that's important. The treatment team needs to know. We need to know how to address high-level safety risk. Okay, let's do another one. Legal ethical question related to crisis then too. Patient begins shouting at the nurse, "Stay away from me." He's waving his arms in the air and back in the corner of the room. The initial nursing intervention in this situation should be, look at the responses, pause your video. And the real essence of what we do is least restrictive, and that's going to be a theme in a lot of questions. So talk to the patient in a calm, non-threatening manner. That's the first thing. The question asks for the initial intervention. So the least restrictive alternative is a verbal intervention, trying to talk somebody down. And then other aspects of care management intervention like seclusion, restraint, and medications are even more last resort. Now, when we are talking to a patient, they're not responding well to the verbal intervention. We might offer them as need or PRN medication as well. That could be sedating or anxiolytic. So just note that within this. But always first, verbal intervention before anything else. Okay, next question. One a little bit more related to a more restrictive situation. Patient has been placed in restraint, so they did go to a more restrictive point within the crisis de-escalation scenario. To control assaultive behavior, which nursing measure is essential to ensure the patient's safety and physical needs associated with restraint? Pause your video, try to answer. And then the answer is D. Constant observation is really the concept here. We need to address that. We need to stay in a relationship with the patient. Usually a mental health tech is engaged in referring to being with the patient while they're in restraint and observing them constantly. But the nurse should be around every 15 minutes to check relative to physical needs, and the mental health tech can relay requests within that, in between those periods, associated with hydration or nutrition, let alone elimination. So that's important then too. Okay. All right. Next question. More general legal related question. To reduce risk of a lawsuit based on false imprisonment. So think about, again, patients. Yes, they're on locked units, but false imprisonment would be even a little bit deeper, where they're held against their will, say, in a room or within the context, not necessarily of ordered protocol like seclusion and restraint, but certainly they're invoking a sense of I'm being held when it's not necessary or not realistic. So look, to consider in that context, to reduce risk of a lawsuit based on false imprisonment when planning care for a patient, mental health nurses must give the highest priority to, pause your video, and this is a general principle. We already talked about the idea of least restrictive environment. So least restrictive environment that will be effective. Look, they're in a locked unit. So people could point the finger and say that's about false imprisonment. Now, the framework from clinicians is that this is about treatment and safety in treatment. But we want to be as least restrictive, at least imprisoning appearance-wise within all this to support patient rights and patient sense to self-determination and autonomy. So as best we can within this limited yet structured environment. So hands off as much as possible, certainly minimizing seclusion restraint as last resort kind of modalities that clearly could be denoted or referred to as false imprisonment, or even being held against their will physically in a passive way, just a person holding them or holding them down in a chair, that type of thing. We see this in geriatric facilities a lot, actually, with the way in which, let's say, certain types of chairs or beds are manipulated to prevent the patient from trying to ambulate, maybe because of a fall risk, best of intentions. But that has been used, even in that context, as a lawsuit material for false imprisonment. Okay, next one, psychobiology. Let's go back to that content for a minute. Patient with depression admitted to the hospital based on an understanding of neurotransmitter function, and the nurse will prepare a plan to teach the patient about a medication alters the brain availability of. So in the STEM, the context is depression. So what neurotransmitter matches up to that? Pause your video. And the best answer was C, serotonin. Two neurotransmitters involved in depression, as we talked about, norepinephrine and serotonin. However, the only one that's offered here is serotonin. The other neurotransmitters would not make sense to answer this question. Okay, next. Another psychobiology question. The spouse of the patient experiences generalized anxiety and frequent panic attacks. Asks what is causing the problem. The best explanation for the nurse to give, best response, is that the problem might lie with deficit of a brain chemical called, pause your video, GABA. GABA is your inhibitory neurotransmitter, is implicated in anxiety disorders. The A response. Very good. All right. Let's go to therapeutic relationships, such a core theme within our class. And this one relates even to the crisis themes that I referred to the other day. An action that a nurse who wishes to make effective use of proxemics should take is, you got to know what proxemics is in the STEM now, the context of the question. Pause your video. And the answer is A. Proxemics refers to space, so you want to have enough space between you and the patient, especially one that has become angry and is manifesting signs of aggression. Next question, therapeutic communication techniques. The nurse tells the patient, I notice that you seem to become irritated when we discuss your relationship with your husband. The nurse is using a communication technique known as, pause your video. The answer is D, making observations. I noticed that. That's a key indicator that observation may be the answer, making observation. So that's commenting on what is seen or heard to encourage discussion, to facilitate going on within the therapeutic dialogue, the give and take going on. Okay, another one relative to talking to a patient, you could say nurse-patient relationship, and not so much the communication skills, but context of the relationship. While conducting initial crisis intervention interview with a patient who is severely anxious, so high anxiety, the nurse should, how would you frame your language relative to tone and rhythm? And it would be A. So you want to speak in very short, concise sentence, very black and white, very concrete, but in a calm tone, in effect. And two, you got to keep your stuff together when a patient's really anxious. And then the last one for the review. 10. Which patient can be evaluated as having benefit from the therapeutic factor of universality? So universality was a theme. We talked about Yalom's principles associated with group process. In this case, it's a patient who, pause your video. D is the answer. Universality refers to patient's realization they're not alone, okay, and that others have experienced similar types of feelings and concerns in the past. So, okay, clearly there's other content that I covered, but I hope this helps. This gives you a really good overview and example of the way in which you drill down the question to the stem. Think about how it relates to the scenario in the question, in that stem, what is being asked, and then consider then the best response as we move forward. And that would apply to any other content that I referred to, be it milieu therapy, be it suicide, themes like that then too. So, okay, I hope this helps. And in all this, remember self-care as you're preparing for the exam. Get good sleep. Make sure you have good nutrition on board. Exercise. Take some breaks. And other strategies in support of anxiety management. I say breathe. The most effective anxiety management strategy you can do easily in the moment is effleurage breathing. So just consider self-care in all this. All right, very good. I wish you well, and we will see you on Thursday.